News. It looks like we're going to be ending a little early. Yay! This is, and I'm happy to report this is kind of the light section of our exercise and talk today. So let's go ahead and what's going to happen now is I'm going to spend probably about 15 or 20 minutes talking about value proposition development and give you some examples. And then we're going to spend about 30 minutes talking through the last exercise. It's on that same page as the knowledge share. It's the value proposition exercise. It's in the back of your book. So we're going to spend a little bit of time and start to work on that. Really, the goal is so when you leave here, you have some action items of reports that you might want to get, questions you might want to ask, websites you might want to explore. So when you walk out of here, there's some next steps that you can take. Sound good? Okay. Value proposition. So I'm going to tell you a story. This is actually a client of mine that we presented at, is anybody MGMA members here? Okay, that we presented at MGMA conference. And actually I'll share kind of two other quick things. One is that if you have questions regarding any part of this presentation, there is another call that, what's the date on that, Jacqueline? The 29th of June. So please attend that call if you have questions for me. I'm happy to answer them about your QRUR, value proposition, anything that we've talked about today. And then there's also, I did a webinar for the MGMA, and it's free really to anybody. It's a 90-minute webinar going through details on the quality and resource use report that I didn't cover here because not a lot of us had that report. So if you want a more in-depth blow by blow, you can, that's a free webinar. It's free to anybody, and it's on the MGMA website, so I want to share that too. All right, so this is my client, Salisbury Pediatrics. That's Dr. Magrita. He's a wonderful, total rock star. And so I'll tell you a little bit about them. On the value proposition side, we obviously did not have one when we started. They're a pretty large pediatric practice, 17 providers. They're very integrative. They have just attained their level 3 patient centered medical home accreditation, but they had a very inconsistent managed care contracting strategy, and they didn't really have a posture with the payers at all, except that they knew they wanted more money. So we started to try to help them with how to achieve that through coming up with a value proposition, which is what we're going to talk about now. So that's a little bit about them. So one of the first pieces that we deployed when doing any kind of a value proposition is to start to do your homework. So we began the construction process, which is what the exercise that you'll be going through in about 20 minutes, which is really answering a series of questions about your practice and about what you know about your practice. And then there are some exercises that you can do to attain more information about your practice that you can put on this value proposition. Because what really happens at the payer is this. On the payer side, we have employers that we need to serve. And we take a look at who their employees are. And we say, okay, for this Michelin Tire, for example, we're going to need 5 OBGYNs. We're going to need 2 orthopedic surgeons. We develop networks that way. We know the demographics. We match it up with a network. But we don't know if someone's PCMH certified. We might not have any idea that they have expanded access. Those nuances they don't know. So you've got to start to articulate those things so you can communicate that effectively to the payer. The other thing is we surveyed the payer environment. That little chart that I had up here several slides ago where it had providers and then United and Cigna and Aetna, and you figure out what your ratings were. We did that exercise to understand where we were. And a quick little aside note, we were not Cigna Care designated, and they were very unhappy about that. So what was really great, though, was we invited Cigna to come in and share the reports with us, and we missed it by inches. We actually went through an appeal process. That's how close we were. Any pediatricians in the audience? Pediatric practices? Okay, there's this one measure. It was chlamydia. And it was a crazy measure that they thought it was just ridiculous and they weren't doing it. Well, that's what they got dinged on. So we had the medical director involved, and it was really a great discussion, though, because it helped us understand One of the providers in that practice was really doing really well in many areas. So all the physicians were starting to ask her, what are you doing? Why are you achieving these results and we're not? And a lot of them, what they started to uncover was it had to do with their prescribing patterns and the kinds of things that they were doling out. So anyway, I share that because this payer environment, even if you find that something's wrong, it can lead you down a path that can be very beneficial. And the other piece was we decided we were going to meet with the payers. Now, here's my philosophy, and what I do with all my clients is that I say we need to roll out the red carpet. We need to be nice to them. We need to give them a little coffee mug when they arrive, feed them lunch, and treat them like they're someone that we're recruiting for our practice, so that we put on our best face. And a face-to-face meeting is the most effective thing if you can get them. Payers, what's really happened on the payer side is that they have diminished their customer service units. So there's not a lot of people, and sometimes you cannot get them out to your practice. But if you can, it's a great way to start building that relationship and really having a collaborative approach. And Peggy, my administrator, who is the administrator of this practice, when we do this talk, she does half and I do half usually. She tells the story about a payer that we began our negotiations with, and she really wanted to wring his neck at the beginning of it. That's how poor their relationship was. Had to do with some credentialing issues. But by the time we got through this whole process, he now answers the phone when she calls. He wasn't answering that phone before, and he answers her emails, and he helps her. And it's all because of this path that we walked down with this relationship, which was really important. So that's a little bit about the outcomes for this practice. They actually picked up a lot from an increased perspective by posturing their value proposition. They had better relationships, and they had, most importantly, I think, they established a strategy for contracting based on data. And that's something that they had never, thought to do before. And they're certainly on a path now to not wait 10 years again before they renegotiate their contracts. So I'm very proud of them. All right, so from a value proposition perspective, some of the things, and these are some of the questions that are outlined for you, it's really talking about the physicians, the mid-levels, what their specialties are, anything that you might want to point out from a service mix perspective. Again, the payer is going to know very little about you except that what they need to know to fulfill their network requirements. So any of those things that you want to point out, that's something you want to put on your value proposition. I also like to put a map to show where you are geographically, so they can understand what kind of institutions you might be referring to, and if you have other office locations, kind of the breadth of your organization. You definitely want to talk about any ancillary services you provide, and then any alternative payment models that you're involved with, because what that reflects to a payer is that you are willing to collaborate with others, and that of course is a good thing from a payer's perspective. You want to talk about your affiliations with networks and ACOs, and then any accolades or awards that you're working on. I have a client, it's actually a pediatric practice, and they are in Boeing's clinically integrated network, which they're like the only peds practice in that network. So it's really hard to get in some of these clinically integrated networks, so that we put on their value proposition. So that's another piece, is just basic demographic information and accolades. And then the other thing to start to think about is differentiators. So when you think about the competition, because really what the payer does, and this is what they'll always say to you when you go to negotiate a contract, is this is our market fee schedule, this is what we pay everybody. So what we really want to say is, well, maybe we are not everybody. Maybe we do things a little differently. Here are the things that we do differently. And we'll talk about this in a second, but here's why that's important to you. Because what really happens is that, the payer might not even really connect these dots for your practice per se, but they know intellectually that if a patient does not go to the ED, that's a good thing. So if you have expanded access, then, and I'll tell you a story. I have a client, it's another pediatric practice, and they are in South Carolina, and there was a flood last year. And it was terrible. And there were no pediatric practices open in that region for like a week and a half. And they were the only one that was open. So we were negotiating a contract with a major payer, and I said, count the patients that you saw. So we counted them, and we said we saved them at a minimum, like $150,000 over the weekend, because none of them went to MUSC. And if they would have gone to MUSC, game over. So it's those little moments that, you can capitalize on, and that's how that's a differentiator. So start to think about what those things are. I have another client, a radiology group, that's got an affiliation with a sports team. You never know what's going to resonate with the payer. And here's the other, I'll tell this in a minute, but these things will resonate and the payers will remember them. And any other special programs that you might be a part of that they might not have any knowledge of. So definitely bring those out in your value proposition. And if you can even find an image, it's good to make these things visual as well. So, all right, so goals and ratings. I actually put on all value propositions a little grid, and it's really like United, Cigna, Blue Cross Blue Shield, and what your payer ratings are. Because you want to understand what they are. And if and let's say that you're not Cigna Care designated, well, if you're United Premium designated but you're not Cigna Care designated, maybe there's something there. Because usually if you're designated for one, you are for the others. So if there's a mismatch, you need to investigate a little more. And if you're not designated, start to ask those questions and get that data from the payers. And that's going to help you understand a little more about yourself. What you want to definitely put on your value proposition is a mission statement. And, if you don't have one, these are things that, and this is normally what we do, is that value proposition, that page that's in your workbook, we actually divide that up. I don't have it with me. We divide that up into sections so that it's like 6 pieces of paper. And at the practice level, we hand it out in the practice and give everybody like a different square to fill out. So like the front desk person might be looking for your mission statement. And so it's really neat because it's an opportunity for people in the practice to come together to start to define your value proposition. So it's kind of a really fun exercise, actually. And then people come back with what they've been able to retrieve. You might have someone in billing looking up your payer scores. But it's a good way to divide and conquer and have everyone participate in the exercise, so it's kind of fun. So you want to have your mission statement. You want maybe to talk about some goals, talk about how you rate on these payer programs. If you were successful reporting PQRS, you can say that. Meaningful use, you can say that. So anything that demonstrates that you're forward thinking. And transparency, here's the other piece, is do you understand how you compare relative to peers? Now back on that slide, a few slides ago, I had a bunch of websites there. If you just go and Google yourself on there, it is a really good thing to do. The Wall Street Journal, you can go to the Wall Street Journal today in any position in the country, you can see all of their information. All of it. And Amino, there's a whole list of them. So now, many folks don't understand that data or are not using that data. But as this becomes more user-friendly, I think the impact will definitely become larger. Let's see. And then quality compared to peers. Some of the information in the QR/UR reports is wonderful. And it's graphically presented, and that'll resonate with the payers. And I'll show you an example of that in a minute. But some of that information you can kind of glean and take it and put it in your value proposition, and it can be a great demonstration of how you are different than your peers in a positive way. And then outcomes. This is probably the most critical piece. And if there's nothing else we talk about this afternoon that you take away, please take away this. Because at the end of the day, the payer really cares about outcomes. That's what they really care about. And here's the really fun thing. Usually when I start down this path, we ask the payer for payer reports and information. In this particular payer, you can see we were doing really well in a number of different areas. So we used that data in the negotiation. So they couldn't say this data is not right. This was the data you gave us. This is on, this is your data. So the payer many times will give you this information because it's really good for them. If they don't give you the information, how are you going to improve? So get this information from your payers, and then you can turn it around. I actually think I might have even used that chart in this negotiation. I had another one, ophthalmology group, where our cost of care for cataract removal was $475 a case, and everybody else was like over $1,000. So we created a really simple graph. And so, you don't know what you're going to find, but ask your payers for this outcome information, because that's where we're really disadvantaged. We don't have all the cards. We know We know what we do in our office, but we don't have the total cost of care perspective, so we have to go get it from payer partners and QRUR, and even hospitals. I have a group right now that's asking their hospital partners for what's our infection rate? What's our average length of stay? How do we compare? Because your hospital partners might be able to share that information with you too. Anything that you can give, readmissions, that's very well understood. And I think that's an important point to make too. You want to do something that is going to resonate with the payer. I have some practices that want to really be a little, I don't want to say too innovative, but they're trying to describe something that's really complex and very difficult to get your arms around and hard to quantify. And that might not resonate so much with the payer. So stick to the things that are pretty well understood, and that'll be a little easier for you. So like readmissions, ED utilization, that kind of thing. Patient satisfaction scores, if you have those, that's another thing. So if your payer ratings aren't so great, fill that space with patient satisfaction scores or employee engagement scores. Referring provider satisfaction, that's another thing I've had some clients use. So those are some, I'm going to tell you some stories in a minute, but those are some examples of outcomes. I'll tell you the McDonald's story. So my friend Dr. Magrita, what he had in his practice, and he anxiously took my hand and showed me, he had a, and he wasn't, he had a Burger King meal there too. So he had a McDonald's and a Burger King meal over in this part of the clinic. And it was like 79 days old or something crazy like that. But it looked like you could eat it. I mean, that's how many preservatives were in that stuff, right? But it was, it was part of their teaching for their childhood obesity clinic. And it was amazing because when I talked to the payer about this group after we initiated our negotiation, that's what the payer remembered was the McDonald's story. So, at the end of the day, I was on the insurance carrier side for many years. We're people. We put on our pants, we remember things, we have relationships. So if you can, if it's a sports team or a story or anything like that, they're going to remember. They will always remember their McDonald's story because they thought that was really interesting. And what a great teaching tool for the kids. So that's really cool. So that's the McDonald's story. All right, common ground. And I think this is really important is when you're going to talk to a payer and use some data, go to their website. Oh, thank you. And check out what their goals are and what they're working on. Because whenever I've done that with a group, it's the same. It's amazing. But almost always what we're working towards and what we want to achieve is the very same thing that the payer wants too. So it's a good way to try to get on the same page and then also use the same rhetoric. If they're rolling out something that's new and innovative, is that something that you're working on too? Because it'll resonate with the payer when you talk with them about your practice. And then I like to put questions or at least have questions that I've got in my pocket when I'm talking to a payer about what I want to achieve. And some of the things are, I like to listen a lot. I know it doesn't seem like that because I'm talking forever, but when I meet with the payer, we talk a little bit about the practice, and then I'm like, okay, we just have to be quiet, and let's let them talk about who they are, what they're working on, what their challenges are. And every time we've ever done that, we have learned something very valuable, like a new product they were rolling out that we didn't know we were going to be in, or, God forbid, a system conversion that was coming up. But it's been very eye-opening and and very interesting, and it helps us to do the pre-work of understanding what they're up to and what the common ground could be, so that conversation is as pleasant as it can be. And then defining where you want to be, start with the end in mind, right? So if you want a bundle payment at the end of the negotiation, that's something to bring up with them. Are you doing any bundle payments? Is it working with anybody? Could we be considered as a pilot? Many times these payers are looking for practices to pilot things with. And I think that's a fine thing to do because you're either going to make the rules or you will be following a rule somebody else made. So if you can get in on a pilot, that's always a good thing, I think. So that's a little bit about how to get there and some of the things to keep in your pocket. And some of the key components, key questions, these are just some examples. So you have these investigating types of models. You know, the other piece on the payer side is not every payer is ready for everything. Every payer is different. Even if they have like Cigna, you know, it's really Cigna of Delaware, Cigna of North Carolina. I mean, they're very different even regionally. So just because it's happening in one place, it doesn't mean it's happening in another. So ask them what they're rolling out. And then what kind of arrangements they're doing with your peers. Because if they're saying no to you, know what's coming down the pike so that if they open up a round 2 cohort, you might be able to be considered for that. So here's just some good questions for you to kind of stick in your pocket there. And here I've got some, okay, so here are some stories now. I use this QRUR. I actually used this in a negotiation for a nephrology practice. So they were really good on the cost side. So we took that and we counted the patients for this payer and we estimated, oh my goodness, we're saving the payer over about $2 million compared to our peer groups. If this is similar in other populations, which why would it not be? Those physicians aren't treating this patient differently than that patient. So this data you can translate if your results are positive, and it's a really very powerful statement to make to a payer. So there's one little story. Here's another one. This is a peds story. I have a peds practice that just opened a breastfeeding center. And this is really interesting because they're offering some services that are not reimbursable. They have yoga, for example. They have a lactation consultant that you can text. And they have all of these things set up that aren't traditionally reimbursable. So we came up with a value proposition talking about some high-level things, how many office visits are saved, and really, it's really population management, like right from the womb, right? I mean, starting people off in that way is just phenomenal. So, and we were able to quantify based on some analysis that we did, not QRUR data, but some industry data to say, how much do we save in prescriptions and ED days if a mother is successful breastfeeding compared to if she's not. And this just happened like 2 months ago. But so we actually proposed an alternative payment model to a payer for something that they had no understanding of, and we got it. I mean, we created our own CPT code, and they are going to be able to pay for another FTE. But it's because they had the data. You know, it's because they were able to position that data and say, this is a good thing. I mean, intellectually, we all know that, right? But if you can quantify it somehow, I mean, really the payer was like, why would we not do this? And we know the value of that. So that is their story. And that's not even the mother, all the benefits for the mother, which we really didn't focus on. And then this is my last story. I had a radiology group, and I'm obviously not a clinician, but I'll try to tell this without massacring these words. So a patient came in, he was 50, and it was a possible stroke. And so the time between the CT and the read for this group is 20 minutes, and their peers are 45. So this person who came in with a possible stroke walked out of that ED the same day. In fact, in part because of that time, right? And so we actually, we did some of this work on that value proposition to say, this is why we're different. Imagine the dollars that are saved there, not to mention the life, right? On the patient side. So, and it was cool. I mean, he was showing me all these images on his phone. He's telling me these stories. I'm like, don't do that with the payer. We can put one on the value prop. But, the payers don't, that really kind of brings to life the value that all the things that we work really hard at bring to not only the patient, but to everybody involved. So that's another story. All right, so here's the value proposition tool. You guys actually have a 11 by 14 piece of paper, and I'll tell you, we actually have in the back of the book the questions typed out so you can write some answers in there because this is really small. But what I normally do with clients is we work through these exercises and then we create a value proposition that's actually like 11 by 14. So we're going to go ahead and start to use this information. And we'll take, let's say, the next 20 or 30 minutes and go through asking these questions and walking through these exercises. And then we will wrap up. So it looks like this. And I actually had pick a partner for a sounding board. And you can actually jot, not everyone has a PC, so you've got the printout, you can jot down your answers. Originally we had this for 60 minutes, but we're just going to do 30 minutes. So get through as much of this as you can. I know not everyone has a computer, so we can't look at websites, but my hope is that you identify things that are going to be next steps for you, and you come up with some ideas about what kind of outcome data could we get, what kind of payer do we want to talk to. So whatever would be beneficial, pick a partner and start to explore these things, and we'll talk again in a little bit. Any questions? Yes.
So when you're talking about we talk with the payer, who speaks on behalf of the practice?
Well, it depends. Sometimes you're an administrator. I think the best team is an administrator and a physician. That's by far the best two people to talk to. My PACE practice that did that, it was a physician and administrator team. Mm-hmm. So we're going to go ahead and I'm going to wrap up and hand it back over to Jacqueline, who's going to bring it home for everybody. All right, so thank you so much for your time. It was really a pleasure to talk to you guys today about data and how to leverage it and bring it all together and the value proposition development. I hope it was, even if you gleaned one or two things, that is an absolute success in my opinion. So I hope that there were a few moments where you learned something that you didn't know before or reinforced an idea that you were questioning. So thank you for listening to me for hours and hours and hours today. So just in summary here, I've got a couple of things that I just want to make sure I mention, and that is from a data perspective, diving into the information that's available is really important. We've never had this kind of information before, and the folks that are looking at it and questioning it and understanding it are going to be in the best position to succeed in a lot of the value-based programs that are rolling out quickly across the country. Make sure that you're leveraging your strengths and educate your team. One of the things that I find really interesting is that in many organizations I work with, there's one person that knows the data, but nobody else knows the data. It's just that one person. So share that information because that's where the magic really happens. And you're really important. I think on the payer side, payers we do a really good job at diminishing how practices feel about their importance to the network, but you're essentially what the payer is selling to everybody. So without providers, there's no network. Just like without the provider in the quadruple aim, there's no quadruple aim. So we really have to keep that in perspective. We are important, and the more that we understand our value to the network, the better position that we're going to be in. And collaborate. That's a really, it's not a new concept, but I think many of the first calls I get from new clients is that I really hate every payer I work with, and they won't talk to me anymore. And, it's because of these relationships. That happens so easily. But I think that practices that are able to position and start to cultivate those relationships are going to have more success in a number of ways. So have the end in mind and be the partner of choice. If there's anything I want to impart to you, it's use this data so that you can understand how, if you're not where you want to be, how you can become the partner of choice, not only for payers, but for people that you're trying to recruit. It's talent that you're trying to retain. There are many things that this can flow into. So just a few quick things to leave you with, and I am going to hand it over to Jacqueline, who is going